Welcome to this year's Leadership Polk 13 commencement ceremonies. We're so glad to have so many of you join us from near and far away. This year's class has done an exceptional job of finding ways to make the most of such extraordinary times. They have found joy in all the nooks and crannies as they charted into COVID consternation with resilience and amazing grit. Well done on creating some incredibly wonderful, lasting memories during unprecedented circumstances. These are the folks who did it in the margins without complaining and now can lead in a way that is most needed at this time. It's likely that you would see their lemonade on public shelves because this is the kind of folks that have served Leadership Polk Class 13. I'm proud to present to you this year's Leadership Polk Class 13 with our incoming alumni president, Lieutenant David Black of the City of Lake Wales. Amy Bailey, Community Development Director, City of Lake Alfred. Justin Boulding, Business Development Director, Rodder Construction. Tony Camarello, Executive Director, RP Funding Center, Lakeland. Cindy Durham, Marketing Director, Winter Haven Hospital. Dr. Greg Edwards, Central Florida Regional Director, Advent Healthcare. Steve Elias, Municipal Environmental Engineering Division Manager, Panoni. Benicia Frazier, Project Manager, Central Florida Regional Planning. Matt Green, CFO, Lakeland Christian. Terrell Griffin, Parks and Rec Director, Haines City. Carrie Greiner, Healthcare Administrator, Central Florida Healthcare. John Hill, Superintendent, Polk County Public Schools. Katrina Hill, Marketing Strategist, CMP Marketing Firm. Sherry Kelly, VP of Retail Administration, Citizens Bank and Trust. Travis Keys, VP of Commercial Relationships, Center State Bank. Ashley Link, Marketing Director, Southern Homes. Andrea McDonald, Executive Director, Polk County Sheriff's Office. Mai Ann Nelson, Communications Director, Polk County Board of County Commissioners. Amanda Jo Nicholson, VP of Member Services, Winter Haven Chamber of Commerce. Andy Oguntola, Lake Wales Center Director, Polk State College. Derek Oxford, Certified Financial Planner, CPS Investments. Nick Plott, Government Affairs Manager, Tampa Electric. Chief Andy Ray, City of Auburndale Police. Alan Reed, Principal Creative Executive, Made Branding. Diana Simmons, Chamber Consultant. Brianna Smith, Finance Director, City of Fort Meade. Ben Stevenson, Executive Director, Lakeland Housing Authority. Stacy Walsh, Chief Development Officer, YMCA West Central Florida. And last but not least, Lindsay Zimmerman, Director of Engagement, Central Florida Development Council. Ladies and gentlemen, we couldn't be more proud of Leadership Polk Class 13. Today, I have the privilege of introducing Dr. Elaine Thompson, who's the President and CEO of our Lakeland Regional Health. She's a visionary healthcare leader and talented strategist. She's credited with assembling LRH's elite executive team and compromises some of the nation's most accomplished and innovative professionals. Under her bold direction and desire for continuous improvement, Lakeland Regional Health has expanded its scope of services to rise into national prominence across our county. Since Dr. Thompson joined Lakeland Regional Health in 2010, she immediately began creating collaborative process improvements that drastically improved the patient's well-being. Dr. Thompson's fierce passion for community well-being leads her to actively seek partnerships across our county and region. She works tirelessly with a plethora of organizations organizations and leaders, and it's reflected in her numerous boards that she serves on. Elaine Thompson has been continually recognized for extraordinary achievements in healthcare leadership. And so we're delighted to have her address the Leadership Polk Class 13 and their guests today. Welcome, Dr. Thompson.
Well, it's an honor to be able to be part of the commencement ceremonies for the class of 13, and congratulations to all of your hard work. And grit was definitely the right word to use in describing any class that's graduating in 2020 for certain. So when I was asked to just give some keynote remarks, it was called Reflection of Leadership, was what your leaders at Polk Vision asked me to speak of. I first had to just laugh a little bit about that. I'm retiring from Lakeland Regional Health at the end of the year, starting a new commitment actually in supporting as an executive director of the YMCA. But this year, almost everybody in the city or in the county almost asked me to do some form of their commencement speeches, because I guess that's what you do when you're old and you're retired. People are kind and generous and they ask you to do that. But I was so fortunate because almost all of them got canceled. So it's nice to be able to actually Zoom with the group that asked me to share a few remarks. You're one of the few left standing, and I think it goes back to your grit. I also want you to know that I know sermons or whatever, more than 7 minutes, whether it's Zoom or in person, get a little old. So I will try not to harness you too long in front of a Zoom camera with any outside reflections of leadership that goes back 40 years. But what I thought I would do is just share with you 7 thoughts that I had as you kind of use your graduation from Leadership Lakeland to go on to your next journey of leadership. And I thought I would hold off on like the 6th one when I share it with you, talk a little bit about how I really felt my leadership was called upon in planning to prepare our organization for the pandemic response that we did. So first of all, like Elaine's 7 pearls of leadership. The first one I thought was really helpful in my career so far was just to really know who I am as a leader. And I'm sure that's part of probably what Polk leadership class really helped you do, to take a look at different leaders, to be out there in the community and try to define who you are so you can understand yourself to the fullest. You know, I've had the opportunity in my career to work with probably 3 professional coaches, some doing some of those Myers-Briggs, you know, some doing Strength Finders, some doing DISC. And I would just highly encourage, the more that you can learn from those tools, and the more that the people are following you, by definition as a leader, it's all about people following us. I think that's very helpful, because strengths are what I think we should really feed upon, but when we don't watch our strengths, they actually can become weaknesses. Like when you look at my Strength Finders, belief is my number 1. So I have a very strong belief system. It's probably what suited me really well for working in not-for-profit. But I know I can get a little crazy, almost zealot, because I can take that strength to too far of an extreme and have to roll it back in at times. So I just think when you know those tools, when they're out there for you, take advantage of them, because the more you can know yourself, I think the better you can lead. As I've reflected every year, when I reflect upon who I am as a person, I think I make myself a better leader. The second one, I think it's so important to know where you're going. You know, so I would really encourage, no matter what your job in leading, is to spend time with all your stakeholders making your strategic plan. And this doesn't have to be a 5-year strategic plan. It can be a month strategic plan or a quarterly strategic plan. But it's very hard to get people to follow you where you have not set your direction, where you don't know your beacon, where you don't know your lighthouse. How can people kind of come behind you? So I think it's really important to spend some time right now as you graduate from here and think about, all right, what's the challenges ahead of me in my work environment or in my life environment or my work-life balance environment? And what is my strategic plan for the people who are following me? I think that's just really a pearl that you need to do. The other one is, once you know that, spend some time making sure that you have the structure in place that allows you to do a strategic plan. And don't get stuck with a long structure. Be flexible in your structure. You might ask somebody right now, example, at Lakeland Regional, we have an outstanding senior vice president of the analytics, who we just expanded her role and said, hey, you know, this emergency management is so huge right now. You're a brilliant executive. Take on running the emergency department for us. Where that's not kind of a typical structure in hospitals, that you would take your most advanced analytic vice president and say, hey, get into operations, but be flexible in your structures just to meet that strategic plan. And then obviously hire the right people, train the right people, spend time and develop the right people. And to me, I love competitive people. So a lot of the times when I'm recruiting, I'm looking for people that have played on teams, that have learned how to win, who've learned how to lose, who know how to pass the ball, who know how to make the shot. Find out what's important for you in your set of followers so that you're really enjoying the team, they enjoy your leadership, but figuring out not just what looks good on a resume, but what works for you in terms of the dynamics of your team, I think is super, super important too. One of the things that we picked up incredibly during the pandemic preparation was communication. I can't highlight that enough for you. I would call that my 5th pearls of wisdom for you. And communication can kind of be in 7 different ways. I mean, don't just think you've said it once. You know, you have all the tools of today's world, right? We have Zoom, we have the emails, we have phone conversations. Now with masks, you can have in-person conversations, but repetitive communication is so important to make sure there's good two-way communication for your followers on where you're going. So have big ears, but also at the same time to acknowledge that you've heard folks and yet go towards that beacon. I think it's really important. And then the 6th one, like I said to you, were the one that I wanted to spend a little bit more time in my comments to you, is just when things are chaotic, as a leader, it's the time where you need to really demonstrate your ability to command and control. I see that, you know, in all of us that hold the CEO title, it's the #1 thing that's expected by us, from whether we are looking at a corporate board, a not-for-profit board. They expect in time of unsettledness for us to have command and control. So I thought I'd talk to you a little bit about just Lakeland Regional Health and how we tried to make sure we were prepared for the pandemic and the actions we took in place to highlight kind of some of these points that I talked on reflections of leadership. So as we started to watch February unfold, and we started to watch very clearly the data that was coming out of the state of Washington and the amount of deaths that came out of the first nursing home as cases started to get reported, those of us in the healthcare industry started to really do environmental scans. And sometimes in our work, you can do environmental scans that are ongoing, that last a year, but this called for an immediate environmental scan of what was happening in other parts of the country. And we started to take a look at who would be our advisors for how we would assess what we were doing here in Lakeland as we prepared. The University of Washington definitely led the way for us in the state of Washington. They had early on put all their COVID policies up on their website. As they were learning on how to battle this disease, they became a great national sharer. And the other people that there was just incredible lessons learned, of course, had come out globally before us. So we were looking at not just what was working in China, what was not working in Italy, but what was working on some of the other areas that had some success. And then very soon we were able to watch what was going on in New York. And so that environmental scan became very, very important as something that we focused on. 2, that at that point you started to see premier analytics come out across the country. Some coming out of Mass General, some coming out of the University of Washington, that you literally could put your zip code in and it would tell you on what day you would surge and to how great your numbers would be in your surge capacity. So we started to use those data fields very frequently, and some of them would be updated 2 or 3 times a day. So as we started to put our projections out at Lakeland, we were able to have that analytics as well as the environmental scans that were going on. We set our course very early in saying that we are the 5th largest hospital in Florida. We are an 864-bed licensed facility. We knew that we should prepare at least for 1,000 patients. And so we set that as our goal, was that we needed to be able to handle 1,000 patients on any day. We needed to be prepared for 50% of them to be in intensive care if we needed to be able to administer that care. And we needed to possibly have 70% of them be on isolation and also need ventilator assist if that were to happen. Once we set that as our lighthouse, all of our teams came to place in terms of adding structure and people and planning to what was going on. So our structure started then that there was a people resource center that planned out how many nurses we needed, how many cleaning people, and what we would do with our full-time staff. And then we had plans on how we could expand our staff if needed, if we got up to those peak census numbers. We then, for supplies and procurement, needed to go very boldly into trying to identify protective patient equipment, our N95 mask, our isolation gowns, all of the breathing machines we needed, all of the lab testing materials that we needed. And that became a daily hunt for people on the procurement side, working with finance, our materials management people, and then our material handling people. We started to bring in enough supplies so that we could feed those patients for 1 month if the food chains distribution centers got distributed. So that everybody helped us. Saddle Creek's helped us, Publix helped us in storerooms, in being able to prepare in case we found distribution in the food chain across the country, we'd be able to feed that degree of patients going forward. Testing to this day has been very, very hard. There's very limited amount of tests. The accuracy of the testing machines were not right. We brought in 8 different house testing platforms for COVID. And we continue to still bring more in for that space. Additional structural issues that we found to be challenging was just that it was hard to buy these things. We actually were able to go to a local manufacturer who made face shields for us. They made N95 masks for us. They made hand sanitizer out of one of the breweries for us. So we went into total procurement from the local community too. That has been amazing and supportive as we needed to build up our procurement aspects. And then all the clinical protocols. So there was a whole team of people that came forward to put in our clinical protocols on what was new today. How do we use remdesivir? How do we use steroids? How do we use 100% oxygen flow instead of ventilators? How do we have proning teams? And so there was a clinical part of the organization as well. So in the midst of this challenge, what I think on those pearls of wisdom that I shared with you, what did we do? Well, number one is that we had to set course. The CEO had to command and control it. So again, we're going to be able to handle that large of a patient population if needed to be. We need to have the people to do it. We needed to have the supplies. We put the structure in place to get the people and the supplies. We started on the communication pearl to have 9 o'clock every Monday through Friday management call-in for the entire management team across the system, that they were updated as to what happened from the last day to this day, what was happening in regards to having the PPE, what was the patient census, and how best could we handle this journey that was going to be in front of us. Everything from counting the number of body bags that we had and that were available in case we needed to have more deaths than what our funeral homes could actually happen. So, I've never planned for a pandemic. I thought I'd done my 40 years in healthcare and I was going to retire without a pandemic planning exercise. But I think what helped me in reflection on leadership through this was kind of like just the Hillary's hints that I was sharing with you. Our census went up to the high 800s. At one time, we had 150 folks with positive COVID in the house. We've had probably about 50 ventilators in use at the time, so never to the full 1,000. But when you're looking at getting into the high 800s, it was a very good thing to do. Our staff always had enough PPE. Our hospital never went on divert as other hospitals had to in the community because they couldn't handle the volume. We were able to maintain, after the governor allowed us to do our elective procedures again, all of our elective procedures to be going on in addition to handling our COVID support team. So at the end of the day, I do think from some of the stuff that I shared with you on leadership pearls, it got our organization very much through this first phase, right? We don't know what will be ahead of us in a well-prepared way. And so I just encourage you again to kind of know at the time of chaos, it's really the time that you as leaders now, as you're graduating and all these skills that you've accomplished, don't be afraid of chaos. It's really a time where you can bring this control and command into your arena and probably do the best work that you've ever been able to do. And that brings me just to my last point, which is at times as a leader, you need to be courageous. It's very hard for me to set that oh, let's plan for 1,000 beds and 50% will be in an ICU and 70% of them will need ventilator support, and we're going to march to that. Very hard to call Publix and say, hey, can I have some cold storage because I want to bring in more food, or Saddle Creek, will you help us with other storage areas, or go to the person from LEDC and ask them, hey, can you make me face masks or whatever. But I think the biggest thing that hopefully you can take from this wonderful year of education, that you've met a lot of people that you thought knew who they were. They knew where they were headed, and they had the structure and the people and the communication skills to be there. That they're all prepared for the next level maybe of chaos that they'll need to control. But at the end of the day, my biggest encouragement for you is just to show the courage to know who you are as the leader you are, and be able to take those calculated risks so you can bring that to your organization, and you can bring that to your family and to our community. So again, hopefully, like, I'm humbled that you asked me to share, you know, some reflections of leadership. I'm sure each and every one of you could have done a better job than what I just did on the Zoom. But again, congratulations, and I appreciate being asked. Thank you.
Thank you. Dr. Thompson, do you have a second? If anybody has any questions, I think she may have a moment or two of either leadership reflection, or if you have any questions. I do want to say I've been privileged to work personally with her. She's my immediate past board chair, and she's going to continue on our board of directors. It's been a privilege for me to be able to get to know this woman directly, and she walks the talk. I can attest to that. She's been one of the most supportive board chairs I've ever had the privilege of working with. And thank you so much for carving out time for us today. And as far as your business resource directory, and I know you stopped short of mentioning that, but for those of you who have not had the opportunity to do the research on the Lakeland Regional Health website, for those of you who are still managing policy, for those of you who are still concerned about the right way to allow workforce to re-enter or to manage your client base, there's a huge amount of resource available through the Lakeland Regional Health website. I'll make certain that we shoot that out to you. There you go. Thank you for doing that, Kirsten. And I want to say that our policies at Polk Vision were developed from that resource directory, and they keep it current. So as science becomes available and as trends become available, it's not a one and done. It is an active learning environment for those of you that feel you could benefit from visiting that site. And thank you for your leadership in establishing that on your website. Does anybody have any questions for her? I think you probably could just unmute and speak up if you have any. No?
Can I just make one comment then
Sure.
too? I know a lot of the other people when they were introduced were from a lot of our care partners in the community. So I just wanted to thank them. I saw Advent Health and Central Florida Healthcare and Baycare, and truly this was so many of the hospitals and the other providers working together to try to keep our community as safe as possible. And they have been tremendous community partners. I just want to give a shout out to all the other healthcare providers and everything that they've done, and our elected officials and our city officials too, and our first responders. They've really been tremendous this year. So I'd be remiss not to acknowledge their incredible efforts and talents. So thank you.
Okay, thank you, Elaine. Talitha, did we have anything further for Dr. Thompson, or are we ready to move on? Thank you.
Bye, guys.
Thank you, Dr. Thompson. We appreciate it. Thank you so much.
Is it me?
Yes.
Okay. Well, again, we have our fresh faces, and I wanted to just talk a bit about the greatest class ever. The best class ever for Leadership Polk. It's constantly a wrestling match now between all of us, and I would like to think that Class 1 was the best class ever. Of course, that's me with red hair. I was a bit lighter then. And that's class 1, and you will see in front of you the sheriff, you will see Mike Kerr from the city of Winter Haven, Colleen Burton, Joe Tedder. I think it's the best class ever. What I would like to say though is class 13 has a unique distinction as well. I think you're going to go down in the annals too, but I would like to say that while you may not rise to the greatest class ever, you certainly are going to rise and probably hold that distinction for the foreseeable future of being the longest class ever. So that is my distinction for you, is you will hold the record for the longest leadership class. They didn't have to deal with COVID. Okay, Andy, you've got me there, but you are the longest class ever, which means you're tenacious, and we need tenacious leaders. So the words of wisdom I have for you, I couldn't say anything better than Dr. Thompson. She's a really hard act to follow. So with that, I think it's time for us to talk about your future as alumni members, and I think Dina Ware has a few words of wisdom for you.
Thank you guys for allowing me to participate today. Can you hear me?
Yes.
Okay, good. Okay, just wanted to say a few words to the class. During these unprecedented times, we've all been faced with many challenges, both in our professional lives and at home. We've had to juggle work schedules or homeschooling or aging parents or whatever the chaos. We've done that all while trying to keep some sense of sanity. But during these unusual times, we've all found creative initiatives to band together, from the in-person meetings to endless Zoom meetings to virtual ceremonies like this one. But regardless of the challenge, Class 13 did it. And as Talitha mentioned earlier, you guys have been resilient. You have continued to push through. So congratulations to Class 13 for sticking with it, for continuing to keep going, even when you didn't know what the next obstacle would be. And we hope that after graduation, you will consider joining our alumni team of professionals because of the value, the connectivity, the fellowship, all of the things that have helped ground us and help us find that sense of place during these unusual times. So again, congratulations, Class of 13, and we know that you will continue to do great things moving forward.
Thank you, Dina. They're an outstanding group, and we'd be remiss, I guess, not to tell you that Dina is graduating from our Leadership Polk Class 4, and she has been all over. Her leadership skills that she's gained from across the county as a public servant is shown in the several municipalities shared across, and she recently just got appointed as a Winter Haven and CRA manager. So Dina knows very well what it's like to have the tenacity to come through. She has been the first minority woman to serve as a public servant and the town manager of Dundee before she took this position on as CRA manager in Winter Haven. And so we're extremely proud to have Dina as our alumni council chairperson, and she has been gracious enough to continue on for another year and sail that ship through as we move through these times together. So thank you, Dina. Thank you for not just serving in the areas that you live and your community, but well beyond that in the borders of Polk County. You've done an outstanding job, and so thank you for what you'll do for us, for our alumni team, and that it's been a pleasure. So well done, guys. This is it. You've kind of come to the end of your time. I know we will be seeing each other, hopefully a few of you in our days ahead, maybe in Lakeland and Lake Wales. You know, part of me, I was a little bit sad that we've had this pandemic eclipse, this leadership program that you've had for this year. But man, if there's one thing that I've learned about COVID, that it has revealed the resiliency of the human spirit. And for such a time as this, leaders were born. And so to have you guys leading us and being part of an organization like Polk Vision and from catapulting from this, it couldn't be a more pivotal time for leaders like yourselves to rise up. The kind of leader that collaboratively connects with others, is compassionate and humble enough in character to move forward, remarkably resourceful, honest and proactive, is courageously not afraid to take risks, and yet enthusiastically determined to make a difference. You are those kind of leaders. That's why you were chosen for this program, and that's why you're going to be the leaders for our county moving forward. And we're grateful that we've been able to connect during all of this. Thank you for being the kind of leaders that we can look to when things are hard, and the kind of leaders that are not afraid to make the decisions to move us forward. You know, leadership's not always about being in charge of people. The real job of a leader is taking care of those that are in your charge. And I'm grateful for the great leaders that you are and how well you do that. You know, it's not about a rank. It's really about the relationship and your willingness to take responsibility. And it is shown more than ever before. And so, you know, hard things can be tough, and, you know, with them comes great responsibility. But isn't it great that you as leaders, you get to kind of give away all that credit because you get to be part of that team and lead them well. So that true value in a leader is not just measured by the work that you do, you know, it's measured by the others that you inspire to do that work. So continue to do that. Continue to keep your head up and do that well, that you may rise above and be those great leaders. And while you do that, you lift others up along the same way. I hope you've enjoyed the part of the book that we ended our program with. It has certainly been a game changer for me and what I've learned from it. And so I hope it has been the same for you moving forward. And again, congratulations, guys. I guess our gift to you today is that we get to end a little bit earlier with all the technical difficulties that we've had. The best gift we could probably give you is a shortened Zoom call that didn't linger for a long time. So just on behalf of Polk Vision and Leadership Polk, and thank you for doing an outstanding job this year. Thank you for just being wonderful. And it has been my honor and privilege to kind of walk alongside with you in this journey. So thank you for all that you guys done. Congratulations. It feels so silly just bringing everything, but congratulations to everyone. We're so incredibly proud of you guys, and we can't wait to celebrate in person with you guys in the new year and just congratulate you face to face. So well done. Leadership Poll Class 13.
Don't be strangers.
Yeah. Bye, everybody.